Okay, in some breaking news, Wegovy, or generic semaglutide, has just been approved for the treatment of MASH. So let's talk about MASH, what the symptoms are, and when you should get checked. So I'm Tiffany. I am a physician assistant, but also a GLP-1 advocate. So I help people get access to GLP-1s when they cannot get them through traditional insurance. So if you're struggling with that, there are some links over here in my bio that'll help you out. So MASH stands for metabolic-associated steatohepatitis. Now, it's part of a spectrum of diseases that we used to call fatty liver disease. And basically, fat builds up in your liver, and over time, this triggers inflammation. Now, ultimately, that leads to fibrosis or scarring, and then this can lead to cirrhosis and even cancer. So we think about 6% of the US population has this, but it's pretty underdiagnosed. But that's about 15 million people. So you're at high risk for this if you have type 2 diabetes, if you're overweight or obese, or you have elevated triglycerides or elevated bad cholesterol, which is the LDL. So MASH is a progressive disease, meaning that without intervention, it's going to get worse. It can lead to advanced scarring, fibrosis, liver failure, and liver cancer. Now, this is why a lot of people even end up on a liver transplant list one day. Honestly, symptoms can be a little tricky. Some people get unexplained fatigue, weight loss, muscle weakness, but the vast majority of people have no symptoms until it's in the advanced or late stages, which is kind of scary. So up until now, we had no FDA approved treatment for MASH. So this is why this is such huge news. So until now, all we could tell patients was focus on lifestyle changes like diet, exercise, and obviously we know how hard these things are. So the FDA has just approved semaglutide for the treatment of people with MASH that already have moderate to severe fibrosis. So when we look at the study that this was based on, 63% of people that had MASH that were placed on semaglutide saw complete resolution of their MASH. Now, these people did not see any increase in their scarring that they already had. Now, when you looked at the placebo group, about 30% of the placebo group actually improved with lifestyle intervention only. But let me tell you what's even more promising. 37% of the group that was placed on semaglutide actually had improvement of the scarring. So previously, we really didn't know that scarring in the liver could actually be improved at all. So that is so encouraging for me as a healthcare professional. So this is not a cure, but it's a huge step forward in the treatment of liver disease. So if you're at high risk, if you have diabetes, if you are overweight or obese, or you know you have elevated cholesterol levels, this is something that you need to talk to your primary care provider about. And maybe it's time to consider adding semaglutide to your regimen. If you don't have good coverage for that, I've got some options in my bio that can hopefully help you out. So just let me know what questions you have about this. This is excellent news.